Good afternoon, everyone. I am Rick Rinehart, Deputy Director at CPWR, the Center for Construction Research and Training, and I would like to welcome you to today's webinar titled An Update on OSHA Guidance for Workers Not Covered by the COVID-19 Emergency Temporary Standard, or ETS. This webinar is part of an ongoing CPWR NIOSH COVID-19 webinar series in which OSHA has partnered with us on many occasions. Today's webinar is a follow-up to a previous one in the series where our presenter, health scientist Christina Dragon, with OSHA's Directorate of Technical Support and Emergency Management, provided information on initial COVID-19 guidance from OSHA. The previous webinar by Christina, along with the rest of the COVID-19 series, is available at cpwr.com/webinars. Along with Christina, we also have Larry McGowan on the panel to participate in the Q&A after the presentation. Larry is a supervisory industrial hygienist with OSHA's Directorate of Enforcement Programs and has previously presented for us on OSHA's National Emphasis Program for COVID-19. In addition, I am pleased to say that we have Dr. Scott Earnest, Associate Director for Construction in NIOSH's Office of Construction Safety and Health, who will lead us through today's Q&A. We received many questions in advance during the registration process, and Scott will focus on those first during the Q&A session, followed by live questions we might receive if time allows. Please feel free to type any questions that come to you into the Q&A box at any time. So with that, I would like to say welcome back, Christina. Thank you for being here to provide an update on this important topic, and I will now hand it over to you.
Thank you so much, Rick. I really appreciate it. And it's a pleasure to join you again today to give you an update on OSHA's updated Protecting Workers guidance. So for those of you that recall the last time I came and chatted with you, this is the guidance that's available on the OSHA.gov/coronavirus/safe-work. And it was originally published at the end of January this year. And we recently were able to update this guidance in early June to reflect a lot of the advances and changes in the science, as well as increasing vaccination rates, and accommodate the OSHA's issuance of the Emergency Temporary Standard for Healthcare. So this updated Protecting Workers guidance is specifically meant to cover those who are not covered by the Emergency Temporary Standard and identify COVID-19 exposure risks to workers who are unvaccinated or otherwise at risk, and help them take the appropriate steps to stay safe and healthy at work. These recommendations are advisory. They're not necessarily going to be used for enforcement. That's something Larry can speak more to, but they are intended to provide workers with the essential information to continue protecting their unvaccinated and otherwise at-risk workers. We'll continue to work with CDC and other federal partners to monitor the need for additional updates to our guidance moving forward. So one of the differences that we've tried to highlight here is unvaccinated or otherwise at-risk workers, recognizing that there are some people who may have health conditions that prevent them from receiving the full benefit of vaccination. There may be any number of reasons that somebody may not have that full protection, and we want to make sure that anybody in any workplace situation has the opportunity to get the resources and protections that they need to be working safely. Some of the recommendations that we have are very similar to those that we had in the original Protecting Workers guidance. Following recommended precautions and policies, that could be something that a workplace has laid out in their COVID-19 prevention plan. We encourage employers to ensure that workers have the opportunity to get vaccinated, including providing them with paid time off to go and receive their vaccination. Vaccination is part of a comprehensive multi-layered approach to preventing COVID-19 spread in the workplace. For those who are unvaccinated or otherwise at risk, wearing a face covering properly can also be a beneficial mitigation strategy. Again, physical distancing, same things that we have been talking about for the last year and a half, really, to help folks who don't get the full benefit or have not been vaccinated yet. And of course, employers should be providing training so that their workers are fully up to speed on what the practices are in their workplace. And of course, practicing good personal hygiene. A little bit more about the roles of employers and workers. There should be a fully engaged process with workers and employers and worker representatives to determine how to implement a multi-layered intervention approach. There are 11 points laid out in our updated guidance, and I've enumerated a few of them here. Like I mentioned, granting paid time off for getting vaccinated, providing those who are unvaccinated or otherwise at risk with face coverings or surgical masks unless their work tasks require a respirator or higher level PPE. Educating and training workers on your specific workplace COVID-19 policies and procedures using accessible formats in a language that they understand. Maintaining ventilation systems. And of course, implementing protections from any form of retaliation. We also provide an appendix that includes specific measures for higher risk workplaces with mixed vaccination status workers. Some of these parts might be applicable to those in the construction industry, depending on where their locations are. But in general, the 4 higher risk workplaces include manufacturing, meat and poultry processing, high volume retail and grocery, and seafood processing. For those who are in higher risk workplaces with mixed vaccination status workers, there might be additional considerations for increased close contact, prolonged duration of contact, and of course, what kind of work situation or type of contact folks are in. Other distinctive factors include sharing employer-provided transportation, so being in confined vehicles, or frequent contact with other unvaccinated or vaccination status unknown folks in a community setting where areas with might have elevated community transmission. For those of you that have been paying attention to the news, I'm sure you know that the Delta and Delta Plus variants are spreading rapidly, particularly in unvaccinated communities across the country. So ensuring that folks who have the opportunity to get vaccinated do is definitely a first line protective strategy. And then also for communal housing or living quarters, particularly on board vessels or with other unvaccinated or otherwise at risk individuals. In all higher risk workplaces, there are some protective strategies. These aren't new. These are very much what we've been advocating for quite some time now, including staggering break times so that folks are not clustered together or in large, tightly packed groups and break rooms, staggering workers' arrival and departure times, providing visual cues to remind folks that they should be keeping physically distanced and wearing masks if they are not vaccinated or have other health risks. And then implementing strategies that are specifically tailored to whatever workplace you're in, including improved ventilation. And then, of course, especially with areas where people are working close together, making sure that workers are either staggered or that there is an additional layer of protection added in there. I know in most construction settings, many of which might be outdoors, Ventilation is a little bit easier since Mother Nature does a really great job of moving air and circulating it around us when we're in outdoor settings. But if you are working outdoors in very close proximity with others who have unknown vaccination status, it might still be a good practice to try to physically distance as much as possible and wear a face covering or surgical mask if available. Just a little bit more information for the appendix in regard to retail workplaces, including suggesting folks who enter into those spaces. That might be true in a construction site as well. If somebody new is coming on site and it is unclear or they don't disclose their vaccination status, it would be beneficial to suggest masking for those situations and encouraging continued physical distancing. For traveling to and from work and employer-provided buses and vans. I know in some construction situations, folks just show up on the work site, so that's less of the employer's concern. But if there is any employer-provided transportation, that would definitely be an area to ensure that workers are taking the appropriate precautions if they are unvaccinated or otherwise at risk. And then here we are. We have a lovely little highlight showing where you can find updated information on the OSHA COVID-19 website. We have a little link to flag the emergency temporary standard for healthcare, and then also a flag for the updated mitigating and preventing the spread of COVID-19 in the workplace. And with that, those are the updates that I have for you. So I'll turn it back over to Rick.
Great. Thank you, Christina. And I guess I'll turn it over to Scott to start the Q&A.
Sure, absolutely. Thanks, Rick. Thanks, Christina. And we will begin with the questions that had come in previously through the registration, and then we'll move to ones that come in through the live chat. So the first question from registration has to do with looking at the differences between somebody who has been fully vaccinated and how that practically, what's the difference between a fully vaccinated person and somebody who has actually had COVID-19 and recovered, or for that matter, somebody who has been tested for COVID-19 and came back negative within 10 days. So, could you touch a little bit on sort of how those, sort of practical differences between those groups of people?
Scott, I can talk to that a little bit, and Christina might want to jump in too, but practically for OSHA's concern as far as enforcement, we just want to see that the employer takes into account the vaccination status, or at least has some kind of plan for accounting for vaccination status, because this, as Christina mentioned, it affects the risk in the workplace. And so handling workers that are been fully vaccinated or only partially vaccinated, or employees who are not vaccinated for either some medical reason or just their choice. An employer has to deal with all those situations, and OSHA just wants to see that the employee is dealing with that situation in a safe manner and following the CDC guidance on that.
Yeah, I think the only thing that I would add to that, Larry, is that it's really critical that the employer knows the difference and understands that, for those who are receiving the 2-dose vaccine, a person is not fully vaccinated until 2 weeks after the second dose, or 2 weeks after the first dose if they're getting the Johnson & Johnson single-dose vaccine, and that vaccination is definitely a more consistent way to get immunity and protection than necessarily having been naturally infected and then recovering from it. And then those who have been tested for COVID-19 in the prior 10 days and tested negative, that's just really a point in time estimate that says that 10 days ago they did not have an infection, right? So I think for any employer considering this, they need to be clear on what they're looking to be measuring and tracking for their workforce, and that's really what matters.
Okay, great. Thank you very much, Larry and Christina, for that answer. Let's go to the next question that came in through registration, and that is, what is required for construction employers who work primarily outdoors in the heavy civil or in the transportation construction industry?
Tim, would you like to jump in on this one?
Sure. Well, working outdoors is, as you mentioned, and Mother Nature does a great job on ventilation. And usually working outdoors, there is an effective ventilation, so the concerns aren't as high working outdoors. In the heavy civil projects, what you have to worry about is working inside the cabs of the equipment. Usually it's only an individual, they're by themselves, and they are outdoors on that. So you caught me a little bit off guard on that. I wasn't quite ready for that one.
My apologies. My apologies. Yeah, I think that's I can't really add that much to that response, though. I think only in those situations where there isn't another local, state, federal, or workplace recommendation in place. That's generally true.
I mean, if you're specifically talking about the heavy outdoors, you do have to, again, consider the application. If you're going to be working in an excavation that's requiring multiple employees in the excavation and close contact, please consider if the employees are at risk, and consider wearing face covers that might not otherwise have been required in close contact.
And as we are in some places already fully ensconced in the summer, OSHA does have a couple of really beneficial guides on wearing face coverings in hot and humid outdoor conditions, as well as hot and humid indoor conditions available on our website.
Okay, well, thank you very much for that response, and we'll move on to the next question. Has to do with vaccination status. It says, what is OSHA expecting for verifying or checking vaccination status of workers in the construction industry so that we continue to provide the safest work environment possible for unvaccinated and at-risk workers?
So in our updated Protecting Workers guidance, we don't specifically have any requirements or recommendations for employers to track those things. But in order to implement a COVID-19 prevention plan within a workplace, it would be judicious to have some way of ensuring that so I don't think, Larry, do you know if there's stuff specifically in the NEP that provides more details about that?
Well, we would, like you said, we would want to see what the employer is doing with their COVID plan, and employers are recommended to check their vaccination status of their employees. They can do that by talking to them, by looking at their vaccination cards if they have them. They can go and document it all. But if we had a compliance officer looking at the site, and we would be looking at their plan and asking the employer, have you looked at the vaccination status of your plan? And we may interview some employees, asking them to confirm about vaccination status. We wouldn't keep any personally identifiable information. We'd just be asking these general questions of vaccination status of the employer and interviewing some employees to get an idea of how the employer is handling this as a risk factor. So
Okay, thanks for that response. And then the next question from the registration is, do you have any good examples of a COVID-19 hazard assessment?
Yes, well, soon. We are working on updating OSHA's COVID-19 website with a more detailed hazard recognition and assessment page, as well as a more updated control and prevention page. Those are working their way through the clearance process right now. So please stay tuned for those updates, but I will say that an effective hazard assessment should include identifying hazards for workers, identifying and implementing measures to adequately control for those hazards, and then making an assessment of whether the combination of mitigation and control measures at that specific work site in that environmental context are effectively controlling those hazards. So those are the three primary parts that are really for having a good hazard assessment.
Okay, another thing I would add to that is just there's information about hazard assessments also on CPWR's clearinghouse. There's really a tremendous amount of information there about COVID in general and trying to do a good hazard assessment. And the construction program at NIOSH also put out checklists that are pretty helpful for the construction industry for both employers and employees. So you may want to refer to those checklists that are on CDC's website. Next question has to do with enforcement. It is how can OSHA's guidance be used by COSHOs for enforcement purposes? Probably a question for Larry.
So, since there is no emergency temporary standard applicable to construction and non-healthcare, we've since the beginning of the pandemic talked about the applicable OSHA standards that we would enforce, such as PPE, sanitation standard, signage, and the respiratory protection standard in some cases where you're dealing with the higher risks for COVID-19 and exposure there. And then the overarching OSHA Act that has a general duty for employers to protect their workplaces, protect their employees, and that's the general duty clause. And we have enforced that in a few cases. So now that this new factors this year of vaccination, as the workforce is getting more and more vaccinated, we're adjusting, we're taking this into account into our risk factors, as Christina mentioned on our updated guidance. And outdoor risks are deemed lower as well. So those factors all come in as we look into enforcement. As far as using OSHA guidance is based on available guidance from the scientific community, such as the CDC and the FDA and USDA in a lot of cases, and academia. So we look to the latest science, and if we're looking at a general duty clause where we're trying to show that the employer should know of this risk and there's feasible ways to reduce the hazard, we would look to industry guidance that the construction industry may have, CPWR. If there's guidance out there, we would point to that and say, look, construction employer, you have an industry group that is providing you all this guidance. You have the CDC that is providing all this guidance. We try to not actually cite based on OSHA guidance because it's not enforceable. So we would look to, for that general duty clause, we would look to external sources of guidance that the employer, we have to make the case that the employer has no knowledge of this hazard and feasible means to abate. That might have been too technical an answer, but if there's more questions, we can go farther on that.
Okay, no, that's good. Thanks, Larry. Appreciate that explanation. Let's go to the next question. It is about basically it states, will OSHA adopt a standard for airborne infectious diseases in addition to the COVID-19 standard?
I don't think we have any information about that at this time.
Next question that came in the registration. What is the recommended guidance where a state has eliminated COVID mitigation requirements, such as masking, and do employers still need to require non-vaccinated individuals to follow COVID mitigation practices if the state Department of Health regulations don't require it?
Larry, do you want to take a stab at this one?
Yes, and there's a lot of states, especially in the spring, a lot of states started dropping their masking requirements for outdoors, some indoors. The CDC has said certain workplaces should still, even because of vaccination, and so certain workplaces still should be wearing masks if they're dealing with COVID hazards in healthcare, correctional institutions, and homeless shelters. So for a state, say Texas, maybe have dropped their masking, and a construction employer is there and is not required to wear a mask. But you may have unvaccinated employees. So a lot of those state regulations are for vaccinated employees. So if OSHA sees that the state has dropped their vaccination, their masking requirement, and goes on site and the employer says, all my employees are vaccinated, OSHA maybe looks at some records, looks at their 300 injury and illness log to see if there's any recent cases, and then we would be okay, and we would probably leave unless there was another hazard that we're called to the site for. So those state mandates can be trumped by a federal mandate. I don't know if Christina mentioned this, but the CDC still has mandates for all public transportation, regardless of vaccination status. So I think that is still in place. So
Yes, it is.
Okay, very good. Thanks for that response on that one. We'll move on to the next question. It says, posing questions to workers about whether they've been vaccinated or their COVID status seems to infringe on HIPAA rights. How do you approach queries for the public good without infringing on the right of privacy?
Okay, so I think there's a couple of really interesting things to unpack with this question. First of all, the HIPAA, Health Insurance Portability and Accountability Act, predominantly only pertains to insurance and health coverage. So it's not an issue for employers, and I'm happy to provide the links to more information about that and the specific responsibilities of employers, which are very few. Employers have the right to ask about these questions, particularly in terms of keeping their workforce safe. They have the option to require vaccination if they are a private company as well. And if there are additional questions, there's a really excellent page that's done by the Equal Employment Opportunity Commission. It's a COVID-19 resource page, and it talks about workers' rights and also ensuring that folks are able to protect their privacy appropriately, and workplaces are able to remain safe as well.
Okay, and then there's another sort of follow-up question. It's pretty similar. It says, is there any indication as to whether or not OSHA will provide guidance to employers to when it is appropriate to ask employees for proof of vaccination, and how to collect that information? What is the appropriate method for record or data retention?
I don't have any information about that at this time. I don't know, Larry, do you have additional thoughts?
well, I did talk a little bit about that. Employers have a lot of leeway on how to approach that. And you can look, even though the emergency temporary standard for healthcare doesn't apply, but it talks a lot about what OSHA would expect a healthcare employer and how to approach that. And so there are ways to approach it just with verbal communication with your employees. OSHA is not insisting on any kind of written records or documentation. If you have it, they will look at it and happy to look at it. And if you have it in a plan and then you have all these records, we would be happy to look at that. But the employer can basically use any method they feel, or they can not ask them at all and just treat all their workers and workplaces as, unvaccinated or possibly mixed and treat it as they would before the vaccination was in place.
Okay. Move on to the next question here. It is, how do you recommend that we prepare for the next pandemic? How can OSHA's guidance prepare us for future events like this?
Well, I think that's an excellent question, and I think it's very forward-looking to be thinking that this might happen again and be prepared for it. I think a lot of employers will benefit from having a detailed COVID-19 workplace plan in place, and that can easily be adaptable to any other infectious disease outbreaks that we might have. At this time, I don't know that we're specifically crafting recommendations for future preparedness, but that would be something that would be beneficial. Larry, want to add anything?
No, I don't have anything to add to that. That sounds good.
Okay, and then the last question from registration, it's, are employers in the U.S. requiring workers to be double vaccinated as a safety requirement? Or are employers determining that some workers are in safety-sensitive positions and are required to be vaccinated? For example, first aid attendants.
So absolutely, employers can require that somebody is vaccinated. I'm not entirely sure what they mean by double vaccinated. That is not a term that we have been commonly using in any way. If somebody is receiving a Pfizer or Moderna COVID-19 vaccine, those are a 2-dose vaccine where after the first dose, you will have some amount of immunity, but really to achieve maximal immunity, you want to have both of those doses in your shots. So I don't know, we still don't know whether we'll need to get booster shots in the future as the virus continues to change and adapt and more variants arise. But that's something that could happen. And I think it is really important, especially for, I think the healthcare ETS addresses this in some capacity, that there are higher risk situations where workers will get a lot more workplace protection if they are vaccinated.
Okay. From there, we'll go ahead and just look at a few of these questions that came in on the chat. Looks like there's just a small number currently. One of them says, and this is related to vaccinations again, have you seen any best practices for communicating vaccination status for workforces with vaccinated and unvaccinated employees? Is there a way to communicate vaccination status without violating privacy?
I think that's kind of related to the one we discussed earlier. I think if you think about the workplace as its own little community, right? Everybody wants to make sure that they're taking care of the rest of their community. So employers are able to come up with some kind of a strategy to ensure that they are tracking and ensuring that those who are either unvaccinated or have other high-risk situations are being protected. And I think there is a lot of latitude for how employers decide to implement that, but I do think that that's a really critical part of keeping all of the workers safe.
I would only add that, you know, there are a variety of ways that you can imagine that an employee would do that. You know, specifically segregating them or saying all my unvaccinated workers, you're teleworking, although you couldn't do that at a construction site, but or wear a little sticker if they're vaccinated. But the other point that is important is that there cannot be any retaliation, or employees cannot feel like they're being retaliated against because they're not vaccinated and getting unfair treatment. Employers can offer bonuses to workers that want to get vaccinated or provide their own vaccination capability on their work site. I've heard of some, I don't know if NIOSH has been involved, but I've heard of actually at construction sites bringing on a vaccination mobile van to increase the number of workers being vaccinated in the construction industry. So just the understanding that employees that choose not to be vaccinated for personal reasons or for medical reasons cannot be treated differently, other than treated appropriately, but not discriminated against.
Okay, another question on the chat, and I think this has been touched on a little bit before as well, but it says, outside of healthcare, OSHA will cover other occupations under the National Emphasis Program. Would failure to follow these guidelines be cited under the General Duty Clause as part of the National Emphasis Program?
Right, I talked a little bit about that on how we would cite this guidance. And this guidance for this webinar is about OSHA's guidance, but OSHA's guidance is based on the latest science, and we would look to industry sources of guidance and CDC as well if we're looking at an employer's knowledge of safe work practices. That is why OSHA's, you know, we're not just an enforcement agency, we're a compliance assistance. We want employers to be helped and aided to comply with our standards and comply with best practices. So it's a twofold, and there's lots of resources through OSHA and through industry groups like CPWR to help employers succeed and to keep their employees safe.
Looking over the chat, I mean, it appears to me that we've addressed most of the ones that have come in on the chat. Just trying to see if there's anything else that, any other questions that have come in that we haven't touched on, but I feel like we've really done a pretty good job here of covering most of the issues that have been raised. Yeah, I think that's really about it. So at this point, I guess we can go ahead and wrap things up. I just want to take the time to thank both Christina and Larry for a great presentation, for excellent answers on the questions that have come in. I want to thank Rick and Jessica from CPWR for hosting this, and also for everybody that's called in and participated in the webinar. Just want to thank everyone for all the work you're doing for the construction industry and protecting construction workers. So with that, we'll wrap things up. Hope everybody has a great afternoon. Thanks so much.
Awesome. Thank you.